Okay, so I did my community health needs assessment on Jackson, Mississippi, where I have been born and raised. Our university hospital here, which is our biggest trauma one center in the state, is the University of Mississippi Medical Center. Um, as to no one's surprise, Mississippi is probably one of the poorest and unhealthiest states. The majority of our population come into the University of Mississippi Medical Center for multiple reasons, including like access to care and poverty, access to healthy foods, lack of health insurance. We struggle with obesity, hypertension, diabetes, all the chronic diseases. Our infrastructure is unfortunately very poor. The roads in this town are probably the worst in the state. Most people come down here and say that our roads are the worst they've ever seen. Potholes are everywhere. Very poor maintenance. They will be potholes in the middle of a busy road for months at a time, which makes it very, very unsafe for all of our residents. Our water system has been failing continually for the past few years. We've been on like a lockdown, total water boil state for multiple times. Um, we don't drink the tap water here. If we do, we have to boil it. We have lots of aging pipes and leaks. A lot of this is due to flooding that has happened in the past. But in 2021, the residents have been without drinkable water for at least a few weeks. If you start your bath water or try and brush your teeth, half the time it is brown. Physical environment. So the air and water quality. The city of Jackson's water system has more than 71,000 water connections. The quality and safety of the water in Jackson is a recurrent problem that the city faces. When you look at the statistics, our air pollution is actually pretty good. Obviously, we've talked about the water quality. When you look at the hazard risk ratings for our climate, extreme heat in the summertime, precipitation, we get a lot of rain. 27% of buildings in the state are at risk for flooding, and 95% of the buildings are at risk for wildfire. Housing and transit, we do have JTRAN, which is the city's official public transportation system, and we have coming from the Union Station transportation facility, we do have Amtrak and Greyhound. We also do have an international airport here. Housing wise, our poverty is about 25.9%, and Jackson has the highest number of homeless people in the state. The median household income here is about $42,000. Crime in Jackson has been increasing significantly. The crime rate is about 44%. We have one of the highest crime rates in America. A lot of people are now moving out of Jackson to suburbs for safety. We do have a lot of like social support. The public health social workers have many programs such as First Steps, Healthy Moms, Healthy Babies, genetics, family planning, child health. We also have Stew Pot that's been around for a while. It's a community kitchen for anyone that wants to come in and eat, or they provide housing and shelter for the homeless. It is a Christian-based nonprofit. So education in the state. Jackson Public Schools struggle a lot just because we don't have a lot of money, but high school graduates in the city of Jackson is 87%, and people that have a bachelor's degree or higher significantly is decreased from that at 28%. Access to healthcare is a huge problem within our state. Jackson, not as much just because we aren't as rural as like the Mississippi Delta, but people with a disability that are under 65 is 10.8%, and people without health insurance in our city is 16.5%. A lot of people do not have vehicles in order to get to hospitals or clinics in order to get their care that they need. The unemployment rate in Jackson is currently 2.7. Chronic diseases in the state are leading in obesity, diabetes, heart disease, and hypertension. These are mainly highest in household incomes that have less than $15,000. We already talked about the median household income is about $42,000, and people in poverty is about 25.9. A fact for transportation is the mean travel time to work for anyone over the age of 16 is about 20 minutes. So many strengths and weaknesses that our community has is that Jackson is very affordable compared to other cities in the country. We really do have a pretty good education system around the state, and the job market is pretty good as we have plenty of job opportunities available. However, our weaknesses is crime, obviously our economic opportunities. We're a very poor state. Lots of wildfires. We went over the infrastructure issues that we have, and we do have a high annual mortality and prevalence of obesity, hypertension, and high cholesterol. This is just kind of some basic data of our total population. Numbers are like a little different here, as like they say bachelor's degree or higher is 30%. The employment rate is 54%. People without health care coverage is 12.7%. And then it gives you like our total households. So in order to benefit our community, a community garden would be a great way to incorporate healthy behaviors into our community. So a lot of people don't like to go exercise in a gym, but it gives it a fun way to exercise and improve our physical health. It increases your access to fresh fruits and vegetables, and it positively impacts our mental health and can reduce anxiety, depression, and stress. This increases our food security, and also it provides social interactions that can lead to friendships, and for environmental benefits, the growth of plants overall improves the soil quality and air quality. Economic benefits of these community gardens is that it decreases social expenses. Property values increase in areas that have beautiful community gardens. Educational benefits is that it can teach individuals an important life skill and teaches the importance of healthy diet and exercise. As for community, it brings the neighbors and community together as a unit. They support the health and community in so many ways. And then marketing, as we can go talk to schools and hospitals around town, placing flyers around the community for people to join. And these are my references.